Here we go, here we go, here we go. Yes, hello everybody. We are live and it's Hump Day with Dr. Alex Earl. And this is the time I get to spend with you guys and talk about plastic surgery topics and of course answer all your questions. Please remember I'm a double board certified plastic surgeon, trained, Ivy League trained, Duke trained, and I'm happy to answer any question you may have regarding plastic surgery from head to toe. But before we get into that, I want to delve into a little bit of a topic that we see all the time. And the reason I've talked about this before, but the reason I want to talk about it today is because I've seen it quite a bit on TikTok lately. So I know TikTok is overall a newer platform than Instagram, but when you go to TikTok, and I'm going to say hi to all our TikTok viewers there as well. When you go to TikTok, you still see a lot of posts regarding BBL. You see a lot of comments. You even see other plastic surgeons, mostly from sometimes from other countries. I saw one guy from Australia and some other people on there when they're saying like, I would never do a BBL. I would never, do it on myself. I would never do it on anybody else. And then a lot of people saying, BBL, it's the deadliest cosmetic surgery out there. And then you still see articles in the news about the BBL and they'll continue to write that it's the deadliest cosmetic procedure out there. So we're going to talk about all that. We're going to break it down and we're going to bring all of you up to date to the current numbers regarding BBL and what can be done further and what we do here to excuse me, to make this a safe procedure. So the question is the BBL the deadliest cosmetic procedure in 2023? And the short answer is no, it is not. Okay, but the caveat is when done by a highly skilled and trained professional, right? So in the same way that you wouldn't go to a pediatrician to have your open heart surgery, why would you be going to a gynecologist to get your BBL, right? You want to be going to a board certified plastic surgeon or someone who has experience and training in doing this procedure, and ideally someone who's doing it under ultrasound guidance, okay? But let's take a step back. So why is this so much still in the news, and why are people still saying that this is the deadliest procedure out there, okay? Because at one point in time it was. Before 2017. So before 2017, there were multiple deaths due to this procedure. And so the big, plastic surgery societies out there decided to do a study to figure out exactly what the mortality rate was and exactly what is going on. And when they came out with that study in 2017, the mortality rate was, and let's put this here in red, the mortality rate was approximately 1 in 3,000. Okay, 1 in 3,000, and of course at that point in time, then yes, it was the deadliest cosmetic procedure out there. Okay, but what are some of the big differences? Before 2017, okay, plastic surgeons were actually purposely putting the fat into and deep to the muscle, okay, because the muscle has a better blood supply, and so the survival rate for the fat was better. And also because you had a lot more space to put in the fat, so you can have these like really very drastic results all in one round. Okay? The downside, as we all know today, is that underneath that muscle you have these very large vessels called the superior inferior gluteal artery and vein. Okay? Especially the vein. And if you injure that vein and fat gets into that vein, it basically has a direct route to the lungs, causes what's called a pulmonary fat embolism, clogs up the lungs, and the patient can potentially die right away. Okay? So this study came out, and then the big societies, aesthetic society and the plastic surgery societies, they created some guidelines. And the number one guideline is that you can only put the fat in the subcutaneous plane. Okay? You should not be putting the fat into or deep to the muscle. There were other guidelines about using, a strong rigid cannula with a blunt tip, single hole, 4 millimeters, how you position the patient, etc., etc. But basically, the entire concept is to avoid putting the fat into or deep to the muscle. Of course, you got to know your anatomy etc., etc. You got to be well trained in this procedure. So then what happened? A lot of the surgeons, especially the board certified plastic surgeons, knew about these guidelines and started implementing the guidelines. Okay? So there was a follow-up study then done in 2019. 2019 we had a follow-up study, and now the mortality rate, which was 1 in 3,000 and the deadliest of any cosmetic procedure, came down to approximately 1 in 15,000. Okay? So much, much less mortality. And now this is equal to the mortality rate of a very well-known, very common procedure that nobody talks about, non-controversial, you don't see it in the news at all, your tummy tuck. It's the same. Okay, perhaps slightly better. So what happens when you see the people talking about this and they're doing their TikToks and they're talking on the news and social media and everything else? They are using old data. Oh, thank you so much. They heard me coughing over there.
Yeah, Rugs is of life.
Awesome, awesome. This is old data, people. It's not the current data. And it really bugs me because you see articles come out, today. I saw an article come out I think a week ago, and they're still quoting that the mortality rate of the BBL is 1 in 3,000. Why? Because they want it to be scandalous, right? They want to catch the eyeballs, they want the big headlines, okay? But it's simply not true. It's simply not true. So in 2019, it's down 1 in 15,000, which is now equivalent to a tummy tuck, okay? And of course, there are continued improvements. And now, if you go to, a member of certain societies, such as the World Association of Gluteal Surgeons, of which I'm not only a member, but a president of that society, the mortality rate is even lower. The studies that we've done within our members, the mortality rate is about 1 in 25,000, okay? Which is quite low, all right? But what's the problem? What's the issue? What's the issue here in Florida, unfortunately? The issue, unfortunately, is that here in Florida, you have people that are not following the rules. They're not following the guidelines. And so in 2021, there were 8 deaths in Florida from BBL. Okay, extremely sad. 8 deaths in Florida in 2021 from BBL. Okay, and it was because people were not following this guideline. Every single one of them had fat into or deep to the muscle, with an injury to one of either the superior or inferior gluteal veins. All right, so that's the key. That's the caveat. When you go to get your BBL, you have to know who you are going to. What do you think the mortality rate would be if you go to a pediatrician to do open heart surgery? It would probably be like 100%, right? You would never do that. I'm using an extreme example. So why are you going to go to someone who doesn't have the experience, who's like a gynecologist or a non-plastic surgeon, someone who hasn't really done this procedure at all? Do your research. Make sure you know who you're going to. Okay, board certified plastic surgeons such as myself, well-trained, top programs, been doing BBLs for over 5 years. I have 3,000 BBLs under my belt, over 2,000 of those BBLs under ultrasound guidance with no deaths, okay? That's the type of surgeon you want to go to, all right? So now we're in 2023, okay? 2023, and what's 2023 all about? It's all about what I just mentioned. Ultrasound guidance, okay? It's really because it's starting to really take hold, and in my opinion, this should be the standard of care for any BBL procedure, okay? After this happened here in Florida, the Florida Department of Health, the Florida Board of Medicine, they instituted an emergency order, which essentially mandated that all surgeons in Florida use ultrasound guidance when doing a BBL. And so for about a period of 3 months, it was mandatory to use the ultrasound here in Florida. But unfortunately, the emergency orders only lasted 90 days. 90 days, that's it. So it went from about June or so through September. And then the order expired. And then we're back to square one. Okay? So it's taken all this time to try to get a permanent, a permanent guideline up by the Florida Department of Health or Board of Medicine. Today, now in the Florida legislature, there are a few bills coming up where they talk about making ultrasound guidance mandatory for all BBLs being performed in Florida. This may or may not pass. I don't know. Politics, things can go either way. But what I can tell you is that it's definitely being debated in the Florida legislature right now. Okay? Whether that's going to pass or not, I can't tell you. But what I can tell you are what our current numbers are here at Pure. And we've actually, created a study, which the abstract of presentation for the study was accepted at the Aesthetic Society, which we will then be publishing in the big aesthetic plastic surgery journal, okay, of our experience here at Pure Plastic Surgery. So, of course, as you know, we have two surgeons here, myself and Dr. Vidal, and I've been doing ultrasound guidance. I've been doing that since 2019, okay. Dr. Vidal has started with us for about a year and a half now, maybe a little bit over that time, okay. And between Dr. Vidal and myself, we've done just about a little over 1,800 ultrasound guided BBLs, okay, and as you know, all with excellent results and no mortality, okay, 0. So that's kind of just a brief history of what's been going on with this procedure, okay. And for those that that are kind of looking at some of these news articles and whatnot, just know that the data that is being used is back from 2017, and that it's not the current data. But again, you have to do your research. You have to go to a clinic that, of course, is certified at the very least by the Department of Health from that state. But ideally, if it's Quad ASF, or even better, if it's Joint Commission certified, that's the highest level of safety that the clinic can have. And then you want to research the surgeon. You want to make sure, you want to look at their credentials. You want to look at their experience. And if they're using the ultrasound for guidance, even better. Okay? All right. So, happy to answer any questions.
You won't believe this.
What's that?
What's a BBL? Here, at TikTok.
Yeah, what's a BBL? Okay,
Yeah.
So sorry. I should have started from the very, very beginning. Yes. So, BBL stands for Brazilian butt lift. That's kind of the colloquial name for it. But what it is a procedure liposuction. So we're doing liposuction 360, which means we're doing liposuction around the entire body. And then we're using some of that fat that we harvested with the liposuction, and then we're transferring that to the buttock and hip area to create a nicer, curvier shape for the patient. So someone that may have a shape that's kind of pretty much straight up and down, we can then create that shape by bringing in the waist, rounding out the hips and giving a little bit more projection to the buttock area.
How long after having a baby you can have a BBL, and why must you wait?
Yeah, so after having a baby, you want to wait at least 6 months, okay? You need to give your body time to recover from the pregnancy, giving birth, and everything else, but also you need all those kind of hormone levels to come back down to baseline. And your body's going to go through, changes. The same way that your body went through changes, during pregnancy, your body's going to go through changes after giving birth, as it comes down to baseline. And really, when you have a procedure like this, you want to have, of course, long-term results, right? So the best way to do that is to start with your body at its baseline, weight, baseline hormone levels, so that when after you have the procedure, you can have a result that's going to last you for a very, very long time.
My surgery, BBL, is in 2 weeks. I'm scared. What if I'm not happy with my results? What can I do?
Right, so the first thing I would tell you is you can't make that decision too early, right? Because you're always going to go through a period where you may not be happy with the results at the beginning, because at the beginning you're going to have a lot of swelling, a lot of bruising, there's inflammation, things haven't settled. So my first advice would be, let's give it time. Just be very consistent and very compliant with your post-op care. Make sure you stay hydrated, make sure you're using your faja appropriately with the foams and everything else. and make sure that you're getting your post-lipo lymphatic massages. You're gonna need at least 20 of those. Okay. So let's say you've done everything right, and you give it, then you have to give it time. You have to give it at the very least 3 to 4 months. Okay. Now you've done everything right. You gave it time. You fed the fat. It's another key thing there. Nutrition. You got to feed the fat, and it's 3 to 4 months. And then you're not happy with something or other. At that point, then you can discuss that with your surgeon to see if something can be done to improve it. If you're going to need repeat lipo, basically a round 2 BBL, I don't recommend doing that till at least 9 to 12 months after your first BBL.
Okay. What if you catch a cold 2 weeks before surgery? Is taking NyQuil okay?
If you're 2 weeks before surgery and you need a little bit of NyQuil, that's okay. All right. And hopefully, the cold will resolve before you get to surgery. And you're not having, like a lot of like respiratory issues or coughing, or a lot of like, especially like green mucus and things of that nature. If you're able to kind of get over that hump, then you should be okay for surgery. But if you show up the day of surgery, you have a lot of green mucus, you're coughing a lot, then it's best to just postpone the surgery, wait till you get better, and then, and then do that once you're feeling healthy again.
I got group B strep with all my pregnancies, but why do you only get it during pregnancy?
Yeah, so that's interesting. So group B strep is actually a bacteria that's pretty common nowadays in the community. So it's really kind of everywhere. So it probably lives in your skin and things like that. But when you're completely healthy, right? It doesn't create an issue, right? It just basically lives with you, but it doesn't cause any problems. But sometimes with pregnancy, especially after giving birth, your immune system comes down, and it can't really fight it off as well, and then it becomes an issue, becomes an infection, and then will require further treatment such as antibiotics.
Okay, this is back on TikTok. Hi, Laura. She said, "Hi, doc. How long should you use the faja for, and how long should I wait to sit?"
Yeah, excellent question. So, and I assume we're talking about for BBL, right, or Lipo 360 and BBL. So you're going to be using the faja in the first 6 weeks. So in the first 6 weeks, you're going to use that faja night and day. Okay, so 6 weeks, you're using it night and day. Okay, and then for the next 6 weeks, you're going to use it 12 hours a day. So we can just say here about 23 hours a day. Okay, and then after that you can stop. So you're going to use it for at least 3 months. Some patients though, they like to use it a little bit longer. So if you want to, sometimes they'll use it for 4 months, 6 months, and that's okay.
Would someone that does cavitation affect the fact if they trying to do a round 2 BBL?
So I mean, you want to plan the cavitation, right? You want to, if you do it, if you're gonna do some cavitation after your BBL, you want to wait, at least 4 weeks or so, and you definitely don't want to do it, in the buttock or hip area where you've had the fat transfer. In order to do it in those areas, you would definitely have to wait till that fat has completely taken, which takes at least 6 to 8 weeks.
How can I calculate my BMI?
Okay, so it's actually quite a complex formula. So the easiest way to do it is just to go to Google, put in BMI calculator. It's going to ask you for your height, for your weight, and then it's going to give you your BMI. Our max BMI here is 30.
Okay, can a lipo be done at the same time when having tummy tuck and boob surgery?
Right, so when you're combining tummy tuck and the breast surgery, it's typically called a mommy makeover. And when we do that, we can do some lipo, but we're limited as to how much lipo we can do by the Florida Department of Health. So the max that we can do is 1,000 cc's of fat, okay? So we can do a little bit of lipo, but not too much. We certainly can't do like a lipo 360. Plus, I wouldn't recommend combining all those procedures. I think it's a bit too much, it's too long under general anesthesia, and the complication rates can be pretty high.
Okay. Doc, this just went. I want a tummy tuck, but I'm scared of pain. Pain
Yeah.
is zero tolerance.
Oh boy. Yeah, you're gonna have to accept a certain degree of pain, right? It's important. It's impossible to have a procedure like a tummy tuck and expect that you have zero pain. No, it doesn't matter, how much medication we give you or anything else. But what I do highly recommend, especially for tummy tucks, is a shot called Exparel. So this is a shot that we can give you during the time of surgery. We kind of inject it along the muscle repair and along the big incision towards the bottom. And it works at kind of like a long-acting lidocaine or novocaine. You know what they give you like at the dentist to numb up things before they get to work? It's kind of similar in that sense, but it can last up to 72 hours. So really, really recommend that for all tummy tucks to minimize the amount of pain. And I've had a lot of patients where they get the Exparel and they don't need to take the narcotic pain medication such as the Percocet. They can go straight, they can do just straight Tylenol.
Okay, I have plenty questions about prices and booking. So, how's the
Okay.
easiest way to have that info, Doc?
Sure, sure. We'll do that, just real quick. So, in terms of, basically getting a consultation, getting booked, getting a quote, the easiest way to do all that is to go to our website, which is www.pureplasticsurgery.com. Okay? So you'll go to our website, and when you go to the website, there's going to be a little box there that says virtual consult. Okay, virtual consult or virtual consultation. You want to go ahead and click on that box. It's going to take you to a questionnaire. Make sure you fill out that questionnaire in its entirety, and it's going to ask you for a few photos to upload as well. Make sure you upload at least 3 photos. If you fill everything in its entirety and upload the 3 photos, then that will get sent to us. It will get picked up by one of our patient care coordinators, and she will then contact you. Now, don't worry if what you want is an in-person consult or a video consult, because this is still the best way to start. But once the coordinator contacts you, she'll be happy to then schedule the video consult or in-person consult if that's what you're looking for.
If I had a PE from birth control years ago, but have been cleared by my hematologist for years, I'm still a candidate for a BBL.
So it's a little bit tricky, but if it was a PE, that was triggered because you were on the birth control, and of course you're off of it now, and it's been many years. It's a possibility, but really we would take this very much on a case-by-case basis. We have to be very careful with any hypercoagulable states when we do this procedure. So people that have histories of PEs, DVTs, people that have a disorder such as factor V Leiden or any of the other disorders that increases risk of blood clots are typically not a candidate for this procedure.
There's a limit of fat for lipo versus the 360 lipo.
Yeah, so every state is different, every country is different. But here in Florida, when we're doing liposuction in an office-based surgery setting, which is what we have here at Pure and what most clinics are here in South Florida, then there is a limit of 4 liters. So 4 liters is the max amount of supernatant fat that you can remove. Now, remember, it's 4 liters of supernatant fat, which means just like the purified fat, not the total lipoaspirate, because when we do liposuction, we remove fat, we remove fluid, there's a little bit of blood in there. So it's not the total volume, but it's the 4 liters of the supernatant fat. And that's our limit here. Other states, other countries have different limits. And it's also not the same if you're doing it, for example, in the hospital setting, in which case you wouldn't have a limit there.
Can tummy tuck cause fat necrosis?
Can a tummy tuck cause fat necrosis? You don't see it very often. The only time you would see a little bit of fat necrosis with a tummy tuck is sometimes along the lower incision. Sometimes the fat underneath the incision can feel a little hard, sometimes like the little marbles underneath there. And that's like, a very limited amount of fat necrosis, but really where you would see that the most, where it causes the most issues is when you're having, fat transfer.
The last one. Do you approve revision for flat spots?
So it depends. I'm gonna put it that way. It depends. So it depends on what's causing the flat spot and whether I think that we can improve the area. Because flat spots can be caused by many different things. For example, one reason for flat spots can be cellulite. Another reason can be scar tissue. Say, sometimes certain injections that you may have had as a kid can cause scar tissues to cause the area to get flat. And sometimes flat spots are just caused by what we call adhesions or septae underneath the skin that are connecting the skin to the underlying muscle. So it really depends on what exactly is causing the flat spot to determine whether it can even be revised or improved, and whether fat transfer is the best way to do that, or if there's another procedure that should be done in order to improve the flat spot. For example, cellulite, right? What if the flat spot is caused by cellulite? Then really the best treatment for that is something that we have here now. It's called Avili. Okay? So Avili is a device that we have that is specific for cellulite, and it's a little probe with a little kind of little knife at the end, and what it does is it specifically cuts down those adhesions, those septae, to release the skin. Okay? So many times this will be the best adjunct procedure to help with those flattened out areas. Okay? All right. Half hour already?
Yes, Doc.
Lord, time flies. Okay. All right. Well, I hope everybody enjoyed the hump day. I hope you now at least you know kind of the up to date true statistics regarding the BBL procedure. But remember, do your homework. Do your homework on the clinic. Do your homework on the surgeon, and make sure try to make sure they're using the ultrasound as well for the safest way to do this procedure possible. All right, everybody. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. Ciao.